Breathe gently, allowing calm to fill you. Today we discuss calming irritated or reactive skin, how to care for skin that feels easily bothered, red, or uncomfortable with the utmost gentleness and understanding. Irritated or reactive skin can feel frustrating and uncomfortable. Your skin might sting when you apply products, become red easily, feel tight or itchy, or react to things that never bothered it before. This reactivity often signals a compromised skin barrier or increased sensitivity, and it needs gentle, thoughtful care. First, understand that reactive skin is often a temporary condition that can improve, not necessarily a permanent skin type. Many factors can cause skin to become reactive: overexfoliation, harsh products, environmental stress, allergic reactions, hormonal changes, stress, or illness. Identifying and removing triggers while supporting your barrier can restore your skin's resilience. The immediate priority when your skin is irritated is to simplify drastically and remove all potential irritants. Strip your routine down to bare essentials: a very gentle cleanser, a bland moisturizer, and sunscreen. Everything else must stop temporarily. Remove all active ingredients. Stop retinoids, acids, vitamin C, and any other treatment products. These are too stimulating for irritated skin right now. You'll reintroduce them later, one at a time, once your skin has calmed. Stop all exfoliation, whether physical or chemical. Your skin cannot rebuild its protective barrier while you're removing layers. No scrubs, no acids, no exfoliating tools. Discontinue any products with fragrance, essential oils, alcohol, or other known irritants. Even natural ingredients can irritate compromised skin. Choose fragrance-free, minimal ingredient products. For cleansing, use an extremely gentle, creamy cleanser, or even just rinse with lukewarm water for a few days if cleansing seems to worsen irritation. When you do cleanse, use only your fingertips with the softest touch. Rinse thoroughly with lukewarm water, never hot, and pat dry gently. Consider oil cleansing if your skin tolerates it. Some irritated skins respond well to gentle oil-based cleansers that don't strip or foam. After cleansing, immediately apply soothing, barrier-repairing products to damp skin. The best ingredients for calming reactive skin include Centella asiatica, which reduces inflammation and supports healing; niacinamide at 2 to 5%, which strengthens barrier and reduces sensitivity; ceramides, cholesterol, and fatty acids to rebuild your barrier's structure; colloidal oatmeal, which soothes and reduces irritation; allantoin, which is calming and healing; and madecassoside and other calming botanical extracts. Look for products specifically formulated for sensitive or compromised skin. These typically have shorter ingredient lists with proven soothing components and no unnecessary irritants. Apply your soothing moisturizer generously. Don't skimp. Your irritated skin needs abundant hydration and barrier support. Reapply during the day if your skin feels tight or uncomfortable. Consider adding a facial oil as a final step to seal in moisture and provide extra barrier support. Oils like squalane, sunflower, or rosehip are generally well tolerated and nourishing. At night, you might apply an occlusive like petroleum jelly over your moisturizer on particularly irritated areas. This seals everything in and provides a protective barrier while your skin repairs overnight. Sun protection remains essential even for irritated skin. Choose a gentle mineral sunscreen with zinc oxide and titanium dioxide, which tend to be less irritating than chemical sunscreens. Apply it carefully over your moisturizer. Special soothing techniques. Apply cool compresses for immediate relief. Soak a soft cloth in cool water, wring out excess, and hold gently against irritated areas for 5 to 10 minutes. This reduces inflammation and provides instant comfort. Use hydrating mists throughout the day if your skin feels dry or uncomfortable. Follow immediately with moisturizer to seal in the hydration. Consider using a humidifier, especially while sleeping. Moist air helps prevent your skin from becoming further dehydrated. Avoid all potential triggers while your skin heals. Don't experiment with new products. Don't touch your face unnecessarily. Avoid very hot showers or baths. Protect your face from extreme weather, wind, cold, or intense sun. Keep everything that touches your face scrupulously clean. Use a fresh pillowcase nightly. Use a clean, soft towel each time you wash your face. Avoid makeup if possible while your skin is very irritated. If you must wear makeup, choose mineral makeup with minimal ingredients and remove it very gently in the evening. Lifestyle factors affect reactive skin significantly. Manage stress, which increases inflammation and sensitivity throughout your body. Practice calming activities. Meditation, gentle yoga, deep breathing, time in nature. Sleep adequately. Your skin repairs itself during sleep, and adequate rest supports healing and reduces inflammation. Stay hydrated internally. Drink water consistently throughout the day to support your skin's healing processes. Eat anti-inflammatory foods, fatty fish, berries, leafy greens, nuts. Avoid foods you know trigger inflammation in your body. Avoid alcohol and excessive caffeine, which can increase inflammation and dehydrate your body. Identify and avoid triggers. If certain products always irritate your skin, avoid them permanently. If seasonal changes trigger reactivity, prepare by adjusting your routine preemptively. If stress causes flares, prioritize stress management. Keep a skin diary noting what products you use, what you eat, stress levels, and how your skin responds. Patterns often emerge that help you identify specific triggers. Patch test new products before applying to your entire face, even after your skin is calmed. Apply a small amount to your inner forearm or behind your ear for several days. If no reaction occurs, try it on a small area of your face before full application. Reintroduce products slowly once your skin has calmed. After several weeks of simplified care, if your skin feels comfortable and looks healthy, you can carefully reintroduce products one at a time. Wait at least a week between additions to identify any that cause problems. Be cautious about reintroducing actives. When your skin is ready, start with the lowest concentration and use just once or twice weekly initially. Many people find they can't return to their previous frequency of active use. Their skin has shown them it needs gentler treatment going forward. When to seek professional help. If your irritation is severe, painful, or persistent despite gentle care. If you develop signs of infection, increasing pain, warmth, pus, if you suspect an allergic reaction, intense itching, hives, swelling, or if your skin isn't improving after several weeks of simplified care, consult a dermatologist. Some skin conditions like rosacea, seborrheic dermatitis, or eczema cause chronic reactivity and require professional diagnosis and treatment. Remember that healing takes time. Mildly irritated skin might calm within days. More severely compromised skin can take weeks to months to fully repair. Be patient and consistent with your gentle care. As we close, embrace this truth. Reactive skin needs gentleness above all else. Simplify drastically. Support your barrier. Remove all irritants and give your skin time to heal. Your patience and tenderness will be rewarded. May your reactive skin calm and heal. May you identify and avoid your triggers. May you treat your skin. Welcome to this compassionate space. Breathe slowly and deeply, centering yourself in calm. Today we're talking about hormonal acne and how to deal with it gently, a topic that affects many people and requires understanding, patience, and a multifaceted approach. Hormonal acne is acne driven primarily by hormonal fluctuations. It typically appears along the jawline, chin, and lower cheeks, though it can occur anywhere. It often flares in predictable patterns: before menstruation, during pregnancy, postpartum, during perimenopause, or when starting or stopping hormonal birth control. Understanding the hormonal connection helps you approach this type of acne with realistic expectations. Hormones, particularly androgens, increase sebum production and can cause inflammation in skin. When these hormones fluctuate, acne often follows. This is biological, not a failure of your skincare routine. Hormonal acne requires patience because topical treatments alone often aren't sufficient. You're addressing an internal trigger manifesting externally. Both internal and external approaches work best in combination. Let's start with topical care for hormonal acne. The basics remain essential: gentle cleansing, appropriate treatment, moisturization, and sun protection. Use a mild cleanser once daily in the evening. Avoid harsh stripping products that damage your barrier and make skin more reactive. For treatment, several ingredients help hormonal acne. Salicylic acid penetrates pores and reduces oil buildup. Use 0.52% concentration 3-4 times weekly. Benzoyl peroxide kills bacteria that worsen acne. Use 2.5% concentration as needed on breakout-prone areas. Retinoids are particularly effective for hormonal acne. They regulate cell turnover, unclog pores, and reduce inflammation. Over-the-counter adapalene or prescription tretinoin use 3-4 times weekly or as tolerated can significantly improve hormonal breakouts. Be patient. Retinoids take 3 to 6 months to show full effects. Niacinamide at 5% helps regulate oil, reduce inflammation, and support barrier function. It can be used twice daily and is gentle enough for sensitive skin. Azelaic acid has both antibacterial and anti-inflammatory properties. A product with 10 to 20% azelaic acid can help manage hormonal breakouts. Apply treatments consistently, but always follow with moisturizer. Hormonal acne doesn't mean you should skip hydration. Healthy barrier function supports clearer skin. Now let's discuss internal approaches. For many people with hormonal acne, topical treatments alone aren't enough because the trigger is internal. Hormonal birth control is one option for managing hormonal acne in women. Certain oral contraceptives that contain estrogen and progestin can regulate hormones and significantly reduce acne. This requires a prescription and discussion with a healthcare provider about whether it's appropriate for you. Benefits can include clearer skin, but there are potential side effects to consider. Spironolactone is an anti-androgen medication that blocks the effects of testosterone on skin, reducing oil production and acne. It's used off-label for hormonal acne in women and can be very effective. This requires a prescription and monitoring by a healthcare provider. It's not suitable for everyone. Pregnant women or those planning pregnancy cannot use it. For severe or cystic hormonal acne, a dermatologist might recommend isotretinoin. This powerful medication can permanently change how your skin produces oil. It requires careful monitoring due to significant side effects, but can be life-changing for severe cases. Supplements that some people find helpful include evening primrose oil, which may help regulate hormones, spearmint tea, which some studies suggest may reduce androgens, omega-3 fatty acids, which reduce inflammation, and DEM, diindolylmethane, which may support estrogen metabolism. Always consult a healthcare provider before starting supplements. Lifestyle factors significantly affect hormonal acne. Manage stress, which increases cortisol and can worsen hormonal imbalances. Practice stress reduction techniques regularly. Meditation, yoga, deep breathing, time in nature, creative expression. Sleep adequately and consistently. Sleep disruption affects hormones significantly, including those that influence skin. Exercise regularly, which helps balance hormones naturally. But cleanse promptly after sweating to prevent additional breakouts. Evaluate your diet. Some people find that dairy worsens hormonal acne due to hormones naturally present in milk. High glycemic foods may increase insulin and affect hormones. Consider eliminating these for a month to see if your skin improves. Eat foods that support hormonal balance. Cruciferous vegetables like broccoli and cauliflower support estrogen metabolism. Foods rich in zinc support skin health and hormone balance. Probiotic-rich foods support gut health, which affects hormones. Anti-inflammatory foods reduce overall inflammation. Stay hydrated to support all bodily functions, including hormone regulation. Track your cycle if you menstruate. Notice when breakouts typically occur. This helps you anticipate flares and adjust your skincare accordingly. You might use more targeted treatments during the week before your period when you know breakouts are likely. Be extra gentle with your skin during hormonal flare periods. Don't overtreat or use harsh products in frustration. Gentle consistency works better than aggressive intervention. Address underlying conditions if present. PCOS, polycystic ovary syndrome, often causes hormonal acne. If you have other symptoms, irregular periods, excess hair growth, weight gain, consult a healthcare provider about possible PCOS. Treating the underlying condition helps clear the acne. Thyroid disorders can also affect skin and hormone balance. If you have symptoms beyond acne, get your thyroid checked. Don't pick or squeeze hormonal breakouts, which are often deeper and more inflamed than other acne. Picking causes scarring and worsens inflammation. Keep everything that touches your face clean. Change pillowcases frequently, clean your phone, wash makeup brushes regularly. Be patient with treatment. Hormonal acne takes time to improve. Topical treatments need 6 to 12 weeks to show results. Hormonal treatments like birth control or spironolactone can take 3 to 6 months to demonstrate full effects. This timeline is frustrating but normal. Don't expect your skin to be perfect every day of your cycle. Some fluctuation is natural and normal. You're aiming for overall improvement, not complete elimination of every breakout. Seek professional help when needed. If hormonal acne is severe, causing scarring, not responding to home care, or significantly affecting your quality of life, consult a dermatologist. They can prescribe stronger treatments and work with you to find an effective approach. Consider seeing an endocrinologist if you suspect significant hormonal imbalances beyond just acne. As we close, remember that hormonal acne is complex and often requires both internal and external approaches. Be patient with the process, gentle with your skin, and compassionate with yourself. This is a biological issue, not a personal failing. May your hormonal acne improve with time and proper care. May you find effective treatments. May you have patience for the healing journey. Thank you for this time together. Manage your hormonal acne gently and compassionately. Welcome to this understanding, compassionate space. Breathe deeply and know you're not alone. Today we're talking about hormonal acne, those frustrating breakouts that seem to appear on a schedule, often resistant to typical treatments. Let's explore how to manage hormonal acne gently and effectively. Hormonal acne is deeply connected to your body's internal rhythms and cycles. It typically appears along your jawline, chin, and lower cheeks, though it can occur anywhere. For many people, it flares predictably before menstruation, during ovulation, during pregnancy, or during other hormonal shifts. Understanding this connection helps you approach it with patience rather than frustration. Hormones, particularly androgens like testosterone, influence sebum production. When these hormones fluctuate or increase, your oil glands produce more sebum, leading to clogged pores and breakouts. This is why hormonal acne often begins or worsens during puberty, pregnancy, menstrual cycles, perimenopause, or when starting or stopping hormonal birth control. The gentle approach to hormonal acne combines appropriate topical care with lifestyle support and, when necessary, internal treatments. Because hormonal acne is driven by internal factors, topical treatments alone often aren't sufficient, but they're still an important part of management. For topical care, establish a gentle routine with proven acne-fighting ingredients. Cleanse once daily with a gentle cleanser, preferably one containing salicylic acid to help keep pores clear. In the morning, rinse with water or use a very light cleanse. Use topical retinoids, which are particularly effective for hormonal acne. Over-the-counter adapalene or prescription tretinoin increase cell turnover, preventing pores from clogging and reducing inflammation. Start with 2 to 3 applications per week and gradually increase as tolerated. Always use sunscreen the next day. Benzoyl peroxide spot treatments can help with active breakouts by killing bacteria and reducing inflammation. Use 2.5% concentration to minimize irritation. Niacinamide is beautifully supportive for hormonal acne. It helps regulate oil production, reduces inflammation, and supports barrier function. A serum or moisturizer with 5% niacinamide can be used twice daily. Azelaic acid addresses both active acne and post-inflammatory marks. It's gentle enough for daily use and works well for hormonal patterns. Always moisturize, even with oily, acne-prone skin. Use lightweight, non-comedogenic formulas. Well-hydrated skin with a healthy barrier responds better to treatment. Sun protection is essential, especially when using retinoids or other sensitizing treatments. Choose oil-free, non-comedogenic sunscreen. Now let's discuss internal approaches to hormonal acne. Since hormonal acne is driven by internal hormone fluctuations, addressing the internal aspect is often necessary for significant improvement. For those who menstruate, certain oral contraceptives can help regulate hormones and reduce acne. Pills containing estrogen and specific progestins, like drospirenone, are FDA approved for acne treatment. Discuss this option with your healthcare provider if it's appropriate for you. Spironolactone is a medication that blocks androgen receptors, reducing the hormonal trigger for acne. It's particularly effective for adult women with hormonal acne. Discuss with a dermatologist whether this might be appropriate for you. It requires monitoring and isn't suitable for everyone, but for many people, it's genuinely life-changing. For severe hormonal acne not responding to other treatments, isotretinoin, Accutane, may be considered. This powerful medication requires careful monitoring and has significant side effects, but it can provide lasting improvement for severe cases. Lifestyle factors significantly influence hormonal balance and thus hormonal acne. Manage stress, which increases cortisol and can worsen hormonal imbalances. Practice stress reduction techniques daily. Meditation, deep breathing, yoga, time in nature, creative expression, or whatever genuinely calms you. Sleep adequately. Sleep deprivation disrupts hormonal balance and increases stress hormones. Aim for 7-9 hours nightly with consistent sleep times. Exercise regularly but not excessively. Moderate exercise helps regulate hormones and reduce stress. However, excessive intense exercise can actually worsen hormonal imbalance in some people. Eat a balanced anti-inflammatory diet. Some research suggests that high glycemic foods and dairy may worsen hormonal acne for some people. Consider trying a lower glycemic diet or eliminating dairy for 6 to 8 weeks to see if it helps. Include foods that support hormone balance, omega-3 rich fish, fiber for helping eliminate excess hormones, antioxidant-rich vegetables and fruits, and adequate protein. Stay well hydrated. Water supports all bodily functions, including hormone regulation and skin health. Consider supplements that may support hormonal balance, though always consult a healthcare provider first. Some people find benefit from omega-3 fatty acids, zinc, evening primrose oil, or DEAM, dindolylmethane. However, supplements aren't regulated as strictly as medications, and effectiveness varies. Track your cycle and your breakouts. If you menstruate, note when in your cycle breakouts occur. This pattern helps you understand your hormonal acne and can guide treatment timing. Some people intensify topical treatments during their high breakout phase of their cycle. Be especially gentle during hormonal flare periods. Your skin is more reactive and sensitive during these times. Avoid introducing new products or harsh treatments right before or during your period. Limit dairy consumption. While the connection isn't proven for everyone, many people find their hormonal acne improves when they reduce or eliminate dairy, particularly milk. The hormones naturally present in dairy may contribute to breakouts in susceptible individuals. Avoid touching your face, which transfers bacteria and oil. This is especially important during hormonal breakout periods when your skin is more vulnerable. Keep everything that touches your face clean: pillowcases, phone, makeup brushes. Change pillowcases every 2 to 3 days during active breakouts. Don't pick at hormonal acne. Deep hormonal breakouts are particularly prone to scarring when picked. Keep your hands away no matter how tempting. Be patient with treatment. Hormonal acne often takes longer to respond to treatment than other types. Expect 3 to 6 months before seeing significant improvement. Hormonal treatments in particular take time to regulate hormone levels and show effects on your skin. Understand that hormonal acne may not be completely curable, but it's highly manageable. Even with good treatment, you may have some breakouts during hormonal fluctuations. The goal is significant improvement, not perfection. For severe or persistent hormonal acne, work with a dermatologist. They can prescribe stronger topical treatments, recommend hormonal therapies, or discuss systemic options. Professional guidance is valuable for stubborn hormonal acne. Remember that hormonal acne is not your fault. It's not caused by poor hygiene or inadequate skincare. It's your body responding to internal hormonal signals. Treat yourself with compassion, not judgment. As we close, remember, hormonal acne requires patience, comprehensive care addressing both external and internal factors, and self-compassion. With appropriate treatment and lifestyle support, significant improvement is possible. May your hormones find balance. May your skin clear. Hello and welcome to this calm, nurturing space. Take a deep breath in, and as you exhale, let any tension melt away. Today we're going to talk about sunscreen, not with fear or anxiety, but with understanding, wisdom, and gentleness. Sunscreen is the single most important anti-aging product you can use. It's more effective than any serum, any cream, any treatment. It protects your skin from damage before that damage occurs, which is infinitely more powerful than trying to repair damage after the fact. But let's approach this topic with balance. The goal isn't to make you afraid of the sun or to create anxiety around sun exposure. The sun provides vitamin D, supports your circadian rhythm, and contributes to your overall well-being. The goal is simply to protect your skin so you can enjoy the sun safely and sustainably throughout your life. Let's start by understanding what sunscreen actually protects you from. The sun emits different types of ultraviolet radiation. The two that affect your skin are UVA and UVB rays. Think of UVA as A for aging. These rays penetrate deeply into your skin and cause premature aging, wrinkles, and dark spots. They're present all day long, every day, even when it's cloudy, even in winter. They can even penetrate through windows. UVB rays, B for burning, are the ones that cause sunburn. They're strongest during midday hours and in summer months. While UVA rays affect the deeper layers of your skin, UVB rays primarily affect the surface. Both types of rays contribute to skin cancer risk. Both deserve your attention and protection. Now let's talk about the two main types of sunscreen: chemical and mineral. Understanding the difference will help you choose what works best for you. Chemical sunscreens work by absorbing UV rays and converting them into heat, which is then released from your skin. They contain ingredients like avobenzone, octinoxate, or oxybenzone. These sunscreens are typically lightweight, blend in easily, and don't leave a white cast. Many people find them more cosmetically elegant and easier to wear daily. Mineral sunscreens, also called physical sunscreens, work by sitting on top of your skin and reflecting UV rays away, like a mirror. They contain zinc oxide or titanium dioxide. These tend to be thicker, may leave a white cast, and can feel heavier on the skin. However, they're excellent for sensitive skin because they're less likely to cause irritation. Neither type is inherently better. Both can protect your skin effectively when used correctly. Choose based on your skin type, your preferences, and what you'll actually wear every single day. The best sunscreen is the one you'll use consistently. Let's talk about SPF, sun protection factor. You've seen these numbers on bottles: SPF 15, SPF 30, SPF 50. What do they actually mean? SPF measures protection against UVB rays. SPF 30 blocks about 97% of UVB rays. SPF 50 blocks about 98%. The difference between SPF 30 and SPF 50 is actually quite small in terms of protection percentage, though SPF 50 does give you a bit more margin for error if you don't apply quite enough. For daily wear, SPF 30 is generally sufficient if you're applying the correct amount and reapplying as needed. For extended sun exposure, especially if you're outside for long periods, SPF 50 provides extra insurance. But here's the crucial point. SPF only measures UVB protection. To ensure you're also protected from UVA rays, look for sunscreens labeled broad spectrum. This means they protect against both UVA and UVB rays. Always choose broad spectrum sunscreen. Now let's address the most common mistake people make with sunscreen: not using enough. Most people apply only about 25% of the recommended amount, which means they're getting only a fraction of the stated protection. For your face alone, you need about a quarter teaspoon of sunscreen. That's more than you think. It's approximately 2 finger lengths of product, squeezed onto your fingers. For your face and neck together, you need about a half teaspoon. This might feel like a lot, especially if you're used to using less. But this is the amount that was used in laboratory testing to achieve the SPF rating on the bottle. If you use less, you're not getting the stated protection. Apply your sunscreen as the last step of your morning skincare routine, after your moisturizer. If you're using a chemical sunscreen, wait about 15 minutes before sun exposure to allow it to absorb and activate. Mineral sunscreens work immediately upon application. Don't forget areas that are commonly missed: your ears, the back of your neck, your hairline, and the tops of your hands if they'll be exposed to sun. These areas show sun damage over time, just like your face does. Reapplication is essential. Sunscreen breaks down with sun exposure, with sweating, and with the simple passage of time. The general rule is to reapply every 2 hours when you're in the sun. If you're swimming or sweating heavily, reapply more frequently, even if your sunscreen is labeled water resistant. For daily wear when you're mostly indoors, 1 application in the morning is usually sufficient. But if you're spending time outdoors, by a window with direct sunlight, or if you're out during peak sun hours, reapplication becomes important. Many people wonder, what about vitamin D? It's true that your body produces vitamin D when your skin is exposed to UVB rays, and it's also true that sunscreen blocks UVB rays. This creates an understandable concern. Here's a balanced perspective. You need very little sun exposure to produce adequate vitamin D, typically just 10 to 15 minutes a few times a week with some skin exposed. Your hands and arms during a short walk can provide this. You'll also get some sun exposure on your face before you apply sunscreen in the morning, during reapplication gaps, and from incidental exposure throughout the day. If you're concerned about vitamin D levels, consider getting them checked by your doctor. If needed, supplementation is a safe, reliable way to maintain adequate vitamin D without compromising your skin's health. Let's talk about sunscreen and skin tone. Everyone needs sun protection, regardless of skin color. While darker skin has more natural melanin, which provides some inherent protection, it doesn't make you immune to sun damage or skin cancer. Darker skin tones can still experience hyperpigmentation, premature aging, and skin cancer from sun exposure. The challenge is that many sunscreens leave a white or ashy cast on darker skin tones, which makes them unpleasant to wear. Thankfully, sunscreen formulations have improved significantly. Look for tinted sunscreens, which often work beautifully on deeper skin tones. Many mineral sunscreens now come tinted in various shades. Chemical sunscreens typically don't leave any cast at all. For those with sensitive skin or conditions like rosacea or eczema, sun protection is especially important because sun exposure can trigger flares. Mineral sunscreens with zinc oxide or titanium dioxide are often better tolerated. Look for fragrance-free formulas with minimal ingredients. Some sunscreens are specifically formulated for sensitive skin. These are worth seeking out. If you wear makeup, you might wonder how to incorporate sunscreen. You have several options. You can use a moisturizer with SPF, followed by makeup. You can use a separate sunscreen before makeup, or you can use a tinted sunscreen that acts as your foundation. Some makeup products contain
silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. Guide 61: Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62, Acne Treatment During Immunosuppression and Immune Compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal-related anxiety helps reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology (CBT) combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and Commitment Therapy, ACT, helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44: Peptide Therapies and Bioidentical Hormone Treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45: Nanotechnology in Acne Treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46. Environmental and Climate Adaptation Strategies for Acne. Acne management must adapt to different climates and environmental conditions. Understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection. Sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50. Acne Success Stories, Effective Patterns, and Realistic Timelines for Clear Skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate-severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience through initial adaptation phases, and adjustment of treatments based on response. Common obstacles in achieving success include unrealistic expectations for overnight results, giving up after 4 to 6 weeks before full benefits appear, switching treatments too frequently before adequate trial period, neglecting lifestyle factors, inconsistent treatment adherence, and failing to pursue professional help when home treatment insufficient. Inspiring success often involves recognizing that clear skin is achievable through consistent, appropriate treatment. Most acne-prone individuals can achieve clear or nearly clear skin through proper dermatological care combined with appropriate skincare and lifestyle optimization. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties. 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves understanding gut-skin axis mechanisms and implementing strategies to support gut health offers another angle for acne management. The gut microbiome, the trillions of bacteria colonizing your digestive tract, influences systemic health including skin health. A healthy microbiome supports immune function, intestinal barrier integrity, nutrient absorption, and inflammation regulation. Microbiome dysbiosis, imbalanced bacterial composition, contributes to systemic inflammation, impaired immune function, and intestinal permeability, leaky gut, all of which correlate with worse acne. Several mechanisms link gut dysbiosis to acne. First, dysbiosis allows pathogenic bacteria to proliferate, producing lipopolysaccharides that trigger systemic inflammation. This systemic inflammation worsens acne. Second, dysbiosis compromises intestinal barrier integrity, allowing bacterial lipopolysaccharides and undigested proteins to enter circulation, further triggering inflammation and activating immune responses. Third, dysbiosis impairs production of short-chain fatty acids, butyrate, that support intestinal and immune health. Fourth, dysbiosis impairs estrogen metabolism in the gut, potentially contributing to hormonal acne in women. Several dietary factors contribute to dysbiosis. Excess sugar promotes pathogenic bacteria growth. Processed foods low in fiber and high in additives promote dysbiosis. Insufficient fiber intake results in inadequate short-chain fatty acid production. Excessive omega-6 polyunsaturated fat relative to omega-3 PUFA promotes inflammatory bacteria. Chronic stress, sleep deprivation, and certain medications, particularly antibiotics, also contribute to dysbiosis. Supporting gut health involves dietary modifications. Increasing fiber intake through whole grains, vegetables, legumes, and fruits promotes beneficial bacteria that produce short-chain fatty acids. Increasing omega-3 fatty acids relative to omega-6, eating more fish, walnuts, seeds, reducing processed food, supports beneficial bacteria. Consuming prebiotic foods, foods that feed beneficial bacteria, like asparagus, onions, garlic, and resistant starch supports beneficial bacteria growth. Fermented foods containing live bacteria provide probiotics supporting gut health. Yogurt, kimchi, sauerkraut, miso, tempeh, and kombucha all contain beneficial bacteria. Regular consumption of fermented foods supports diverse microbiota. However, benefits are modest compared to overall diet quality and should supplement rather than replace dietary improvements. Probiotic supplements provide concentrated bacteria claimed to support microbiota. However, evidence for probiotic efficacy is mixed and varying. Some people benefit noticeably from specific probiotic strains, while others see no benefit. If interested in probiotics, choosing high-quality products with documented effective strains, like Lactobacillus and Bifidobacterium species, and consulting your healthcare provider is reasonable. Probiotics for acne-specific benefit remain researched, not definitively proven. Avoiding unnecessary antibiotics protects microbiota. When antibiotics are necessary for infection, taking them is appropriate. However, demanding antibiotics for viral infections, which antibiotics don't treat, harms your microbiota unnecessarily. Using antibiotics only when truly needed protects long-term microbiota health. Managing stress supports microbiota health. Stress promotes dysbiosis through multiple mechanisms. Implementing stress management supports both gut and skin health through this mechanism. Adequate sleep supports microbiota health and is one of the highest impact microbiota interventions available. Most microbiota disruption occurs with sleep deprivation. Prioritizing 7 to 9 hours nightly supports microbiota health. Exercise supports beneficial microbiota diversity. Regular exercise promotes beneficial bacteria growth independently of diet. This is one of the many benefits of consistent exercise. Alcohol, particularly excessive consumption, harms microbiota. While occasional moderate alcohol consumption probably has minimal microbiota effects, chronic excess consumption disrupts microbiota significantly. Smoking harms microbiota, contributing another mechanism through which smoking worsens acne. Implications for acne management. While microbiota science is still emerging, supporting gut health through diet, fiber, whole foods, limited sugar, omega-3 support, probiotics potentially, though evidence is mixed, stress management, sleep, and exercise likely support skin health through multiple mechanisms including microbiota effects. These interventions support overall health beyond just acne, making them worthwhile even though direct acne benefit is still being researched. Guide 37, Hormonal Testing, Evaluation, and When to Pursue Endocrine Assessment for Acne. For women with hormonal acne, pursuing endocrine evaluation can identify underlying hormonal imbalances enabling targeted treatment. Understanding when hormonal testing is appropriate, which tests are relevant, and how to interpret results guides effective management. Hormonal acne patterns suggest hormonal involvement warranting evaluation. Acne appearing primarily on the jawline and chin, concentrated in the lower face, often indicates hormonal acne. Acne worsening cyclically around menstrual periods strongly suggests hormonal involvement. Adult acne onset, particularly after the teenage years, is often hormonal. Acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHAS, dehydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystically affected by anabolic steroids, which cause severe acne, through testosterone suppression effects, though acne treatment itself doesn't affect male fertility. Untreated severe acne might indirectly affect fertility through mental health impacts and reduced relationship satisfaction. Treating acne supports fertility planning outcomes. Guide 96, Acne and Alcohol Use, Interactions and Effects. Alcohol affects acne through multiple mechanisms. Understanding these relationships helps you make informed alcohol decisions. Alcohol increases inflammation and dehydration, both worsening acne. Excessive alcohol consumption notably worsens acne in most people. Alcohol consumption patterns matter. Occasional moderate alcohol probably has minimal skin effects. Chronic excessive consumption significantly worsens acne. Some acne medications interact with alcohol. Isotretinoin with alcohol increases liver toxicity risk. Antibiotics with alcohol sometimes cause nausea and reduced effectiveness. Alcohol increases cortisol and stress, indirectly worsening acne through hormonal pathways. Alcohol disrupts sleep quality, indirectly worsening acne through sleep deprivation effects. Dehydration from alcohol increases skin dehydration, contributing to compensatory sebum production and acne. For optimal acne management, minimizing alcohol consumption is beneficial. This doesn't require complete abstinence for most people, but reducing consumption supports acne improvement. Guide 97, Acne and Smoking, Direct and Indirect Effects on Skin. Smoking worsens acne through multiple mechanisms, making smoking cessation valuable for acne improvement. Smoking increases inflammation systemically, promoting acne. Smokers have higher acne prevalence than non-smokers. Smoking impairs immune function, reducing your body's ability to fight acne-causing bacteria. Smoking impairs wound healing, increasing scarring risk from acne lesions. Smoking damages skin barrier function, increasing irritation and acne risk. Secondhand smoke exposure, while less harmful than direct smoking, also worsens acne through similar mechanisms. Smoking interferes with many acne medications. Some medications have reduced effectiveness in smokers. Smoking accelerates skin aging, creating double damage, worse acne plus premature aging. Smoking cessation, beyond its general health benefits, often improves acne significantly. Many former smokers notice acne improvement within weeks to months of quitting. For optimal acne management, smoking cessation is highly beneficial if applicable. Conclusion: your acne treatment journey. Congratulations on completing this comprehensive 100-guide exploration of acne science, treatment, and management. You now possess extensive knowledge spanning from basic acne biology through emerging treatments and personalized optimization strategies. Remember these core principles as you move forward. 1. Acne is treatable. Whatever your acne severity, treatment exists. You can achieve clear skin. 2. Consistency matters more than perfection. Maintaining a routine 90% of the time beats perfect adherence for 2 months than abandonment. 3. Your acne is unique. Treatments that work for others might not work for you, and vice versa. Personalizing based on your response is important. 4. Professional help is valuable. Dermatologists can identify problems you might miss, recommend optimal treatments, and provide professional therapies beyond home care. 5. Mental health is legitimate. Acne's psychological impact is real. Addressing it matters as much as treating physical acne. 6. Lifestyle factors matter. Sleep, stress, diet, and exercise significantly affect acne. Optimizing these supports treatment success. 7. Early intervention prevents complications. Treating acne promptly prevents severe acne and scarring that would result from delayed treatment. 8. Long-term maintenance matters. Achieving clear skin isn't the finish line. Maintaining clarity requires ongoing appropriate management. Your acne journey is unique to you. Some people achieve clear skin with simple topical treatments. Others require comprehensive professional management, including systemic medications. Both paths lead to clear skin. Whether you're just starting acne treatment, struggling with treatment-resistant acne, or maintaining achieved clarity, you now have comprehensive knowledge to guide your path forward. Clear skin is achievable. Your dedication to understanding your acne and implementing appropriate treatment will lead you there. Best wishes on your acne-free future, potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin. Some dermatologists recommend avoiding though others consider it relatively safe. Sulfur-based products, considered relatively safe historically. Most conservative approach during pregnancy, gentle cleansing only, avoiding all active acne treatments unless absolutely necessary. Many dermatologists recommend waiting to treat acne aggressively until after pregnancy or after breastfeeding concludes if planning to breastfeed. If acne must be treated during pregnancy due to severity or psychological impact, consultation with both your obstetrician and dermatologist ensures treatments are appropriately selected based on risk-benefit analysis specific to your pregnancy. Sometimes treating severe acne is justified despite medication risks if the psychological impact is severe. Post-pregnancy acne sometimes occurs as hormones shift after delivery. Many women tolerate this temporary worsening with the knowledge it typically resolves within months. Breastfeeding considerations. Most topical acne treatments are safe during breastfeeding as systemic absorption is minimal. However, discussing specific medications with your healthcare provider ensures safety. Postpartum hormonal changes sometimes improve acne that was severe during pregnancy. This improvement can be psychologically significant after months of acne during pregnancy. Planning for pregnancy. If you're on acne medications like isotretinoin requires stopping several months before conception. Discuss with your dermatologist if planning pregnancy. Guide 67, Acne in Adolescence, Age-Specific Management and Developmental Considerations. Adolescent acne requires understanding both the physiological changes driving acne and the psychological sensitivities of adolescence. Age-appropriate management optimizes outcomes and builds healthy skin habits for adulthood. Puberty triggers the hormonal changes driving typical adolescent acne. Androgens surge during